Assalamu alaikum. Dr. Hussain Baksh Kolachi YouTube channel is with you, and today we will discuss personal hygiene and community health in detail. And this lecture is for the MBBS as well as for other community medicine students in nursing and public health, as well as the other postgraduate courses where the prevention and preventive medicine or social medicine is taught. It can be beneficial for the MCPS, MP, FCPS people in the community medicine appearing in the College of Physician Surgeon. But basically, this is a kind of lecture which we focus for the third year MBBS as well as for the fourth year MBBS, because in certain universities in Pakistan, modular teaching method is adopted and semester system is adopted, and now the online courses or online lectures are fixed. So this lecture is online, and as I am professor in Isra University in community medicine, so today my assignment was to have prepared a lecture as well as a video lecture for the students of MBBS and other students who are in Pakistan and in other countries can also benefit. So let us start our lecture, and you can see the how medical students can practice and teach personal hygiene in school and community settings. And this is the main focus. And let us see what is further in this lecture. So that I should move the slide. This is the first slide. The second, the objective learning objective as usual. There are four objectives. One is understanding the importance of recognize personal hygiene, a critical role in community health and disease prevention. Second, develop teaching skills, acquire effective techniques to educate diverse population in school and communities. Third, identify key practices, master evidence-based hygiene practices and their proven health benefits. And fourth, explore AI integration, leverage artificial intelligence for modern hygiene monitoring and education tool. And the apply knowledge practically implement hygiene program through community outreach and school-based initiative. As every PMDC has required that the outreach program is also there. So this can also be a part of our outreach community program of the Isra University. These are the figures which you can imagine that how is the impact of, let us see the economic burden due to unhygienic practices, or if we implement uh, the hygiene, personal hygiene, then you can save 300 billion US dollars. I think this is more than the economy of many countries and even many provinces of Pakistan. Hand washing in reduction in diarrheal diseases with proper hand washing 30%. Lives saved and annually 1.4 million deaths prevented globally through hygiene practices. Disease transmission 80% communicable diseases spread by touch and contact. So that is, I think, the great message, and evidence-based WHO and CDC 2023-24 data confirms hygiene as the most cost-effective public health intervention. As most cost-effective public health, and you can see the economy 300 billion US dollars. And if you think that in the year there are 350 days or 56 2 days, 52 days, then every day 1 billion rupees are saved due to hand hygiene or personal hygiene practices, and 80% communicable diseases and the diarrhea, which is the killer of the children in Pakistan, can be reduced by 30%, and communicable diseases transmission can be reduced or can be prevented. So now 9 hand washing steps. You can see that there are 9, and the first is wet your hands, apply soap, rub palms together, rub backs of the hands, interlace fingers, means you rub the fingers in between, scrub thumb, rub palms with fingertips, just like this, and rinse. So the water, you can rinse your hands or you can rub your hands, and lastly dry in the air. No clothes or any tissue paper should be. So these are the proper 9 hand washing beds, and you can have this slide even in the ASPE as well as the talks and WHO standard hand washing technique. This chart is taken from this, and I have taken help from the artificial intelligence to prepare. And you look that within a short time of few minutes, this presentation or PPT was there. Hand washing 20 seconds with soap and water before eating, after toilet use. This is important. 20 seconds. And you can see how the sharp and precise information is given. Bathing in cleanliness, regular bathing with soap, clean clothes, and trimmed nail. Trimmed nail, that is one of the important clean clothes. And these are also Islamic teaching. And in many religions, oral hygiene, brush 2 times a day, regular dental checkup. And third is respiratory hygiene, cover coughs and sneeze, use elbow or tissue. You have seen the same in the COVID, and as well as recently we have super flu in Pakistan, and that cases were reported and even in the world, and many admissions in the UK are there. Food and water hygiene, safe food preparation, clean drinking water, proper storage, hygienic utensil. So these are the important aspects, and I think from this a great message is going to the community, people, and students. And now role model demonstrate proper hygiene practice in daily life. Uh, daily life interactive workshops engage learners through hands-on activities, education, create age-appropriate teaching resources, school health programs, implement sustainable hygiene initiative, community awareness. That is important. I think this is the crux and the central point or the punch point or the bottom line. Organize public health campaigns and events, knowledge bridge link medical expertise with community needs. And you can see that empowering communities through knowledge and practice. You can see that how children you can empower, and they are part of the. Now, the curriculum integration, essential personal hygiene tips for kids to stay healthy. These are particularly for the school, easy hygiene habits to keep kids healthy, confident, and full of energy every day. This is the everyday practice, every time practice, comprehensive education. So, curriculum integration, student health clubs, parent involvement, teachers' involvement, Monitoring and evaluation, track hygiene practices and program impact means research hygiene facilities, ensure access to clean water, soap, and supplies. We are just nearing reaching every corner of the community with health education is important. And you can see the doctor is just in the community, not in the compound wall of the hospitals. Health centers and clinics integrate hygiene program in primary care. Public health campaigns organize community-wide awareness drives and events. Rural and urban health care access. Local health workers collaborate with community health workers and volunteers. Cultural sensitivity. Adopt personal Adapt program to local customs and cultural needs. Now, the smart monitoring AI-powered hand hygiene sensors detect compliance in real time, 92% accuracy in tracking whether you are washing your hands or not. Wearable technology, smart devices track personal hygiene patterns and reminds user 40% improvement in daily hygiene compliance. Virtual reality training, immerse virtual reality simulation for hygiene skill practices, 80% retention rate, and machine learning models forecast outbreaks based on hygiene data. And as already mentioned, AI chatbots, 27% hygiene education and personal education via conversational AI, saving 2.2 million plus user globally. Serving 2 million means this AI chatbot of 27% on hygiene is providing education to 20 lakh people globally. Personalized AI behavioral driven communication adapted to individual habits, continuous learning for optimal hygiene practice, future impacts and integration impact to reduce hygiene related diseases by 60% by 2030. This is part of the SDG goal, Sustainable Development Goal 3. Uh, these are the MCQs, and you can see how often should you brush your teeth. Twice daily is the, and then how long should you wash your hands? 20 seconds earlier than your toilet, as well as eating the food. What percentage of communicable diseases? Already mentioned that 80% is the correct answer, which is not a key personal hygiene practice, hand washing, oral hygiene, sharing personal item, bathing regularly. So sharing personal item is not included in the personal hygiene because but they should be cautious. So these are four MCQ so that you should understand. Takeaway messages. Personal hygiene is fundamental to public health. Medical students serve as a crucial educators and advocates. School and community programs create lasting impact. AI technology enhances hygiene education and monitoring. Takeaway today, start hygiene education initiative in your community. Join school and community health outreach programs. Embrace AI technology for better health outcomes. Led by example in your own hygiene practice. Together, we can build healthier communities through proper hygiene practices. Three things: clean hands, healthy lives, better future. The greatest wealth is health. So, with this, I think we are ending our presentation, and you have learned, I think, a lot about the hygiene before this video and after this video. And I wish all the best. And Dr. Hussain Bashkolachi YouTube channel is providing this facility and these kind of information in easy and in a better way, so that not only the student community but the community settings as well as in Pakistan, beyond Pakistan, or in the whole world, the public health message is refined and sent to the people who are in great need, and where you can understand that how many lives and how many economic and how many health burden can be reduced through the picture which is shown in the start is the Hygiene, which is the mother of our goddess of hygiene, and the initial name you can see in the middle. The Hygiea is holding a snake and a bowl where the snake is being given by milk by Hygiea. She was the goddess of hygiene, prevention, and her sister Panacea was in favor of the cure or in favor of medicine or curative care. So these two uh, streams of the health, one is curative and other is preventive. So this picture is 400 BC old and it is taken from the Greek mythology. I hope you have enjoyed this lecture once again. And I am just showing you once again that lives saved, 1.4 million deaths can be prevented, and 300 billion or 1 billion rupee US dollars can be saved every day by personal hygiene. Dr. Hussain Bashkolaji YouTube channel is with you. The student from the neighboring country, India, Iran, or anywhere the conditions are online, I think this lecture will benefit to them. The ISRA University students, they are requested to like, subscribe, and share, and even all the listeners and who have learned from this lecture. And I am thankful to the AI technology that now we can prepare lecture, we can make the information fast, crisp, and engaging for not only student, for everybody. Thank you very much. With this, Khuda Hafiz, Pakistan, Zindabad.